You've just finished a delicious meal, you lean back, satisfied, and then it begins. A bloated belly, a fiery burn creep up your chest, a burp you didn't see coming. Congratulations, your stomach just filed a complaint and it's not subtle. Welcome back to DocDecoded, where health myths go to die and your wellness IQ gets a glow up. Today, we're diving into a very common issue that turns your happy meal into a horror story. Indigestion, or as your stomach likes to call it, I am not okay. Often feel like something protesting inside you. Especially post food? Is your gut auditioning for a volcano documentary? Stick around. We're breaking down what indigestion really is, what causes it, how to fix it, and when it's time to stop Googling and call a real doctor. And hey, comment below. What's the one food that betrayed you in public? Ours is suspiciously always spicy non-veg piece. So what exactly is indigestion? Medically, it's known as dyspepsia, a fancy word for upper belly discomfort. Let's decode it in simple language. Think bloating, belching, burning, or that heavy, why did I eat that last spicy noodle feeling. It's not a disease by itself, but a symptom. A way your stomach's trying to say, this ain't working. Sometimes your stomach isn't being sensitive, it's being sassy. That's not indigestion, that's revenge. Here's what indigestion might look or feel like: upper abdominal pain or discomfort, which is often meal-related, known as postprandial distress syndrome, or maybe independent of food digestion, called as epigastric pain syndrome. Bloating, like you swallowed an air pump. Excess burping, feeling full too quickly. Nausea and maybe even vomiting, a burning feeling just below the ribs. If you feel like a soda bottle that's been shaken too hard, that's your gut waving a red flag. Now let's talk about what flips your gut switch: overeating or eating too fast. Fatty, spicy, or fried foods taste great, digest horribly. Caffeine, alcohol, soda, liquid troublemakers. Smoking, bad for everything, including digestion. Stress. Yes, your gut and brain are besties. Certain medications like NSAIDs, antibiotics, and iron supplements. Medical conditions like GERD, ulcers, gallstones, or H. pylori. Why does indigestion even happen? Several mechanisms may contribute to indigestion, including acid reflux, altered gut motility or sensation, inflammation in microbial processes. Reduced lower esophageal sphincter tone causes reflux, as in scleroderma and pregnancy. However, also found in common population. What is esophageal sphincter, by the way? In simple terms, you can consider the lower esophageal sphincter, LES, as a ring of muscle at the bottom of the esophagus that acts like a valve, preventing stomach contents from flowing back up into the esophagus. It's essentially a gatekeeper that helps keep stomach acid and food from irritating the esophagus. Increased pressure inside the stomach promotes gastroesophageal reflux in obese people. Movement dysfunction in the stomach is what is called gastric motor dysfunction. Delayed gastric emptying is found in 30% of the dyspepsia syndrome. Moreover, reduction in mobility of the esophagus or saliva production prolong esophageal fluid clearance. Disturbed gastric sensation is another factor in functional dyspepsia, found in 35% of the patients. There may be hypersensitivity to chemical stimulation of the stomach. Immune activation in the lining of the stomach and duodenum by increase in eosinophils and mast cells near lower inner layers of stomach adjacent to nerves. Proliferation in duodenal bacteria are shown to correlate with meal-induced symptoms in functional dyspepsia, suggesting a role for microbiome alteration. Helicobacter pylori, a stomach and duodenal infection, has a role in peptic ulcer disease, but is a minor factor in genesis of dyspepsia. Analgesics or painkillers cause dyspepsia, whereas nitrates, calcium channel blockers, theophylline and progesterone promotes gastroesophageal reflux. Ethanol, tobacco, and caffeine induce lower esophageal sphincter relaxation and reflux. Honestly, with this many triggers, it's a miracle our stomach doesn't just rage quit after every meal. Hey, a gentle reminder. You should subscribe the channel as more indigestion related videos are in the pipeline, which may be useful for you. Indigestion is common. But when should you start worrying? Red flags include unexplained weight loss, persistent vomiting, blood in vomit or stool, trouble or painful swallowing may suggest esophageal infection or inflammation. Difficulty in swallowing is concerning for a benign or malignant blockage in esophagus. Nocturnal symptoms: jaundice, any mass or swelling anywhere, severe, unrelenting pain or chest pain along with shortness of breath. If you have family history of tumor in digestive tract and you start having mild symptoms. If you've got any of these, don't WebMD it. Get a real doctor on the case. For mild indigestion, your kitchen and habits can help big time. Try these: smaller meals spaced out. Chew slowly. Don't eat like someone's stealing your food. Avoid lying down after eating. Have dinner minimum 2 hours before going to sleep. Try losing weight if obese or overweight. Cut back on fried, greasy foods and sugary sodas. Drink plenty of water, but not all at once. For adult, 2 to 3 liters per day. Ginger and peppermint. These are classic natural soothers. Also, maybe don't chase midnight biryani with cola. Your stomach is brave, but not invincible. Still uncomfortable? Medicines to the rescue are antacids, fast relief for acids. 2 blockers reduce acid production. Proton pump inhibitors, PPIs. Even stronger, but not for long-term use without guidance. Prokinetics help move food through your gut. But hold up, don't go pill popping daily without medical advice. These meds have side effects, especially if used too long and without diagnosis. If you are self-medicating, then you are doing harm to your body. Absolutely, please be aware. Your brain and gut, total BFFs. When you're anxious, overworked, or sleep deprived, your stomach throws its own tantrum. Healthy habits can fix a lot. Get regular sleep. At set times, exercise regularly. Try deep breathing or even short mindfulness breaks. Limit alcohol, caffeine, chocolate, and tobacco. Take a low-fat and low-spicy diet. Avoid snacks before bedtime and elevate the head end of the bed. Dietary lactose restriction is appropriate for lactase deficiency, while gluten exclusion is indicated for celiac disease. Low. FODMAP, fermentable oligosaccharide, disaccharide, monosaccharide, and polyol, diet effective for gaseous symptoms in IBS. Treat your stomach like a diva. It just wants peace, routine, and a drama-free dinner. Okay, when should you call in the professionals? Indigestion lasting more than 2 weeks, unable to eat properly or losing weight recently. You're over 40 and getting it for the first time. You have risk factors like smoking, alcohol use, or a family history. You're constantly relying on meds to feel okay. Managing indigestion requires a thorough interview. The physical examination is usually normal, so the doctor may not tell you any significant findings during physical examination except in atypical cases. However, doctor may recommend a few tests to rule out other diagnoses, which may be life-threatening in coming days or months. Blood tests, abdominal ultrasonography, pylori infection tests in severe cases. Upper endoscopy is indicated only in cases with atypical symptoms or any alarm factors. However, heartburn more than 5 years in duration, especially in patients more than 50 years old, endoscopy is advocated to screen a common condition in old age known as Barrett's metaplasia. Early diagnosis, it's a less drama later. So there you have it, indigestion decoded. It's annoying, often harmless, but sometimes a red flag. Listen to your gut. Literally, if it's acting up, it's probably got a reason. If this video helped you decode your gut, hit that like button, subscribe to DocDecoded, and drop a comment below on what food has betrayed you the worst. Until next time, stay informed, stay healthy, and remember, your gut feelings are real, especially after butter chicken.